The probe into the irregular procurement of COVID-19 medical supplies worth billions of shillings by KEMSA has taken a dramatic twist, with the board now throwing the CEO Jonah Manjari and departmental heads under the bus. The board members, led by Chairman Kembi Getura, were taken to task by the National Assembly's Health Committee over the disappearance of donated medical supplies and procurement irregularities. And TV Septolale followed the proceedings at Parliament buildings.
KEMSA CEO Jonah Manjari did not attend Thursday's grilling by the National Assembly Health Committee, and when he finally does, many questions will be awaiting him.
Okay, Chair. I think what...
KEMSA Board Chairman Kembi Getura told legislators that neither him nor the board authorized the procurement of a surplus 7.6 billion shillings worth of COVID-19 related medical supplies.
So if the budget is passed by management for any reason, and the board is not informed that the budget has been passed, then that matter must come before the board in due course for the board to be explained. And I want to say, Madam Chair, that I'm sure this is one of the reasons maybe investigations are going on, why PSC wants investigations to be done to understand how these figures, we reached a figure of 7.6 billion against the budget that we had at that time.
If you were the lowest at that time, Nairobi Hospital will have come to buy from KEMSA and Aga Khan. And more so, they maximize on profit and minimize on losses. So they will always go for the cheaper. So are you misleading the committee, or what is the point?
Nobody will carry anybody else's cross. And when the EACC has finished, the way that say our people have transgressed and they'll be charged, they'll step aside. EACC, on the other hand, could come and say, these people are innocent. Maybe they asked for more things because it was an emergency, it was COVID time, it was a pandemic. Maybe EACC will fight.
Asked whether a supplier by the name Kilig was paid a whopping 4 billion shillings for supply of a mere 450 personal protective kits,
that we were not supplied goods worth 4 billion and 50 million by Kilig. It is not true. And we have not made any such payment.
Kilig is reportedly linked to Jubilee Party Vice Chairman David Murathe.
I have never done any business with KEMSA. I have never done any business with the Ministry of Health. I don't do business with government.
Regarding the alleged disappearance of donated medical kits from Jack Ma Foundation, the board says the governmental clearing and forwarding agencies stationed at the Jomo Kenyatta International Airport are the ones accountable for any loss of the supplies.
I hope that they are going to come back to us after this, and in the next expose, ask us where Jack Ma things received by KEMSA went, and tell us in which budgetary line there was 43 billion shillings that was paid to KEMSA, because it is not true. And those are the facts.
The Public Investment Committee questioned KEMSA's acting CEO, Edward Njoroge, and directed the authority to issue it with a detailed audit report in a week's time before it can proceed with its own investigations.
What we want to know is KEMSA, what they bought, how much is with them. We want to know the cost at which they bought it.
The KEMSA board will on Friday appear before Senate's Joint Health and COVID-19 Ad hoc Committee. The DCI and EACC have 21 days to complete investigations into the KEMSA scandal. KEMSA is still awaiting a response from Health Cabinet Secretary Mutahi Kagwe regarding disposing its surplus stock at its warehouses in Embakasi. Seth Olale, NTV, Parliament Buildings.